I usually have stuff that is light and fun, and we can talk about relaxed things, make some jokes. But I have to talk about something very serious. This entity that I call Post Rhinoplasty Syndrome is a very serious entity. For some reason, among all the facial plastic surgeries, rhinoplasty or nose job has quite a bit of psychological consequences. Maybe it is because it's literally the center of our face and we really identify with it. Or maybe that any change in the nose changes our identity significantly. Or maybe that people who choose to have the nose operated on already have some identity issue that they're not aware of. So it's very important to realize this entity called post rhinoplasty syndrome. A syndrome is basically a collection of symptoms. And in post rhinoplasty syndrome, the symptoms can include anger, guilt, shame, regret, depression, hostility, anxiety, obsessiveness, and can become very serious. And why does it happen to some individuals and to what degree? The degree varies. It could be very mild where, you're annoyed by the nose afterwards. You just don't like it. You're like, yeah, it could be better, but that's okay. Who the heck cares? That's fine, but it could be better. That's okay. You can manage that. Or it could be, mild to medium where you're like, I gotta fix this. This is just really bugging me. Or it could be extreme where you don't think of anything during your working day. You could be at your desk, you're working, but your mind is on your nose. And every now and then you keep looking and you're like, I hate this. I just want to jump off a bridge. So you have to be very aware of these symptoms. Because only if you're aware, then you can improve it. Now there are two parts to it. One is the subjective part. One is the objective part. Objective part is where, you had the nose surgery and there's such a change or there's such a condition or deformity or irregularity or a suboptimal result that is obvious to everyone. And when I say everyone, I do not mean people who know that you had a nose job, because if you tell them I had nose surgery, what do you think? They are going to notice something. I'm talking about just general people, who might look and say what happened to your nose? Then that's a bad change. We need to fix it. That's objective, very clear. Then okay, let's fix it to the point that it is not obvious to anyone. Remember, the job of the nose in terms of its shape is not to get compliments. You'll never find someone walk up to someone or in a cocktail hour say wow, you got a beautiful nose, man, that is so cool. Never happens. The job of the nose is not to distract from your facial beauty. So if it is not distracting from your facial beauty, who cares? It's done its job. That's it. So keep that in mind. It is not going to add to your facial beauty. It just shouldn't distract. That's the goal. Goal accomplished, you're done. Stop worrying about it. So if it is something objectively wrong where people notice and is taking away the beauty of your face, absolutely talk to your surgeon. Don't be shy about it. Don't be defensive. Don't be angry or hostile. Remember, your surgeon wants to help you. If you're not happy, they're not happy. So it's not a confrontational relationship. Majority of the surgeons, 99%, they want to have happy patients and they do care about the patients. So don't think I know he or she's going to be saying this or that. No, they do care. Talk to them. Come to a compromise and see, okay, should we fix this or not? And then once that's fixed, you move on. So that's the objective change. Then you don't have a post rhinoplasty syndrome because that was an objective thing. If it is subjective where your surgeon and maybe another surgeon as well looks and say really it's not that bad, but you are obsessed with it, then you need to step back and say maybe I need to revisit this situation. Maybe I need to tell myself that no, it's not too bad and move on. Otherwise you will end up getting revision surgery that will still probably not give you the nose you want. Then you'll go for another one and the risks keep increasing and you might end up with a nose that is now objectively bad and nobody can fix it and nobody can help you. That is a very slippery slope, so you have to be aware of it. It can get to the point where sometimes you need even psychological help. And it is not something to be embarrassed about. It can happen to anyone. If I went for a rhinoplasty, I know for sure that I would have to prepare myself, and I do intend to get one day for my crooked nose. I'll have to prepare myself that after surgery, I'm not looking at myself all the time saying like, I wish she had lifted the tip a little more. I like it just a little more. I wish she had done it a little more. And the hump, I think he didn't take it out enough. That can happen to anyone. So remind yourself. I always tell patients, look at your nose at 6 feet. Please don't look in the mirror in your hand. 6 feet. From 6 feet, if it looks okay, leave it alone. It's not bothering you. And if you still feel very depressed about it or psychologically disturbed about it, it's okay. It's not anything embarrassing. It happens to everyone. Talk to your doctor. Get the help needed. And then you can move on. And there might be other things in the face that might be distracting from the beauty. Address those. But please be very aware of the Post Rhinoplasty Syndrome. There are many, many great surgeons who have had unhappy patients. You can go look them up. Look up their reviews. And you'll find many unhappy patients. And I was puzzled because when I looked at those surgeons, I'm like, how can they have a result that the patient is not happy? They're amazing. I can't say the names, but I've looked them up. They're amazing surgeons. I would trust them with my own nose. And then I came to the conclusion that they gave their best. But not a surgeon in the world is good enough to fight the post-rhinoplasty syndrome. So please beware. Thank you. And have a happy rhinoplasty.